Welcome, everyone. Can you hear me?
Yes, we can hear you.
Thank you. Thank you for joining today's webinar on strengthening nutrition for growth commitments across the nutrition data value chain. My name is Zipporah, and I'm a senior principal research scientist at Kenya Medical Research Institute. I support research in nutrition, but also at the regional level, I support the Intergovernmental Authority on Nutrition on creating nutrition surveillance systems for micronutrient surveillance among populations. I'm also a founding member of the DINA, Data Innovation Alliance, which is part of the Micronutrient Program. With the March 2025 Nutrition for Growth Summit in Paris, in the horizon, I think it is important that a number of discussions get going at the moment. And so today's discussion will support governments, donors, and other stakeholders in developing smart nutrition data commitments that drive evidence-based policies and programs. One of the 8 nutrition for growth themes is data, research, innovation, and AI. And a key recommendation around this theme is to allocate at least 5 to 20% of total nutrition investments across 3 areas. And these areas will be new evidence generation. We need to allocate resources to support better use of nutrition data and integrated information systems, but also look at strong knowledge exchange platforms and communities of practice. So today we'll hear from experts on lessons learned and opportunities for action across these investment areas. Before we begin, let me just share a few quick reminders on how we are going to run the webinar. And for those who are just joining in now, I would like to request that you keep your mics off unless at the moment of speaking. Keep your cameras off as well. Please ensure that you are logged in with all your full names and affiliation. This will help us also just to have the participants within the webinar also, identify who is present in the webinar. You may rename yourselves. If you are, for example, you've logged in with a gadget that doesn't show your name, you can actually rename it. If you click on the right side where we have the 3 dots at the top right corner of your Zoom window, then please, when we need to introduce yourselves, because we do hope that everybody will manage to do an introduction of who they are, please do that using the chat, but we'll use the Q&A section for questions. Live translation is also going to be available, and please follow the chat instructions to enable you access the AI-enabled translation. It's called Wordly app. So there'll be instructions on the chat to guide you on that. But should you have any challenges, let us know and see how we can assist you. So let us get started. The instructions that are provided on Wordly app will be on throughout. So don't worry, at that point when we have presenters who are not speaking English, you'll be guided on how to go about that. So first we have a presentation from Scaling Up Nutrition Movement Secretariat. And I want to apologize on behalf of the organizers that Afshan Hand could not join us. The Secretary General of the UN and coordinator of the Scaling Up Nutrition Movement was scheduled to speak today. Unfortunately, she's not able to join us. However, we do have a presenter who has kindly stepped in to support this presentation as a keynote address. So first we introduce Dr. Joanne Racing, who is the director of the Scaling Up Nutrition Movement Secretariat. She will discuss the critical role of data in shaping effective evidence-based nutrition policies and the opportunity that N4G Paris provides to invest and prioritize nutrition data. And with that, I want to welcome Joanne to come in. Immediately after Joanne, we'll have another presentation, which is part of the introduction, which is going to be Rebecca Headcamp, who is an associate research professor at Johns Hopkins School of Public Health and DataDENT lead. She will provide an overview of the nutrition data value chain and how investments across it are critical for achieving national nutrition targets and outcomes. So over to you, Joanne. Raising, the floor is yours. Thank you.
Thank you, Sephora, and thank you, distinguished colleagues. And again, apologies for Afshan. She's really quite sick, unfortunately, but thanks very much for tolerating me as a stand-in today as Director of the Scaling Up Nutrition Movement. So it's a pleasure to join you for this really important discussion on nutrition for growth commitments within the nutrition data value chain. And by that, we mean from the point of data collection all the way through how that data is used. And we know very well that nutrition systems need strengthening, and that this is the key to more effective and efficient nutrition programming. Unfortunately, few countries have the well-functioning nutrition systems needed to track progress or inform policy decisions or really help allocate resources. So over 1/3 of the some countries, for example, have either no nutrition information systems or have very weak systems that need a lot of support. Across the SUN movement altogether, we see some really important gaps in the nutrition data systems. So let me go through those a little bit. There's weak community level data collection. Many countries just don't have the standardized methods or trained personnel, which might lead to better programming, and in the absence of that can lead to inaccurate or incomplete nutrition data. Fragmentation of data systems, because nutrition is multi-sectoral, the nutrition data is often scattered across many different sectors, for example, health or food systems, education and WASH. And it's very difficult to assemble or analyze from all these different sectors. And without the skills and the investment within that, it's hard to see the bigger picture on nutrition and know what to do about it. In general, there's limited impact assessments. So often countries are scaling up programs without the right data to inform that. An example might be food fortification programs, which are widely being scaled up, but the data on their effectiveness is incomplete, for example. Overall program monitoring tends to be weak. So even though it's great to see so many governments investing in the homegrown school feeding programs, much better monitoring and evaluations needed to drive some better nutrition outcomes and inform efficiencies around scale. And in addition to that, untimely data, for example, or data that hasn't been collated can make it difficult to respond to new and emerging challenges, such as in the case of a deterioration in nutrition status that might come in response to humanitarian challenges or disease outbreaks. And in this context, having good nutrition data systems in place can literally mean the difference between life and death for some people. It's also important to think about nutrition data systems as a way to future-proof nutrition, making sure that the system can tell us not just about the immediate challenges of the here and now, but also what the trajectory of change is, what new trends look like, and who is most affected, because that's what's needed in terms of being able to respond to future challenges. So it's really important to have in place the systems that track nutrition across sectors and across time, and well-known risks that are coming into play, like climate change. So, for example, what does that mean? Well, that means that we know that nutrition profiles are changing, overweight and obesity is increasing, 70% of all overweight and obese cases are now in low and middle income countries, and it's set to increase. So we need to ensure that that data is tracked and to enable us to respond with appropriate policy and programs. We know at the same time climate change is likely to increase stunting and wasting and micronutrient deficiencies, concentrated in different areas, and knowing how these numbers will increase is instrumental in terms of future-proofing strategies again. We also know that humanitarian challenges are increasing. So having nutritional information systems that can support early action before communities slide to a point from which they can't return is important as we see disaster risk increasing. So these constantly shifting contexts show us why it's important to emphasize localization and sustainability, ensuring that countries have the tools and capacity to generate, own, and use their data for long-term impact. Coming to N4G, the Working Group on Data Research, Innovation and NI has produced a commitment guide with the financial and policy implications. And as we heard at the outset, an important recommendation is to allocate at least 15% of the total nutrition investment towards research, monitoring and evaluation to help design the quality, scalable and cost-effective nutrition programs needed. Better use of existing data that's disaggregated and guides policies, and governance and capacity strengthening and knowledge sharing platforms to ensure that the data is translated into action and other countries, policymakers and stakeholders can learn from that. And so these systems help countries understand impact, but they're also important for attracting nutrition finance. And just looking to some examples, so in Burkina Faso, the National Information Platform for Nutrition Initiative helped integrate 25 key nutrition indicators into a national dashboard. And that tool itself has led to more focused and targeted interventions to tackle specific problems. And it's been an important method in guiding resource allocation. And it's good to see the improvements beginning to take shape across Madagascar, Benin and Mali, where some partners are also supporting efforts to improve data systems and strengthen governance. So in closing then, for the commitment making, we close with a plea to governments to ensure that nutrition data is integrated into national development plans, not as an afterthought, but as a core pillar, because data is key to the timely action, efficiency and impact we want to see. And also a plea to the donors to support these country-led initiatives, ensuring that funding supports not just the data collection, but effective use, in terms of policy making. And this is what's essential to unlocking national government finance and therefore essential to the sustainability of nutrition actions. So The more commitments we see at the N4G that prioritize nutrition data, the stronger our systems will become. Strengthening this evidence base isn't just important, it's the essential driver for real impact. And with that, I'll close. Thank you very much. And over to you.
Thank you. Thank you very much, Joanne. I think over to you, Rebecca.
Great. Thank you so much. So I think there's going to be a slide coming up with the image of a data value chain. And so the title of this webinar is about commitments across the nutrition data value chain. And so it's really important that we come into this with a shared understanding of what do we mean. And so that's what I'm going to try to do in the next few minutes. So the idea of a value chain is not a new concept. It's something that's used in engineering. It's something that's used in business. It's basically a process by which we get to a finished product or by which we add value. And if we think about information and evidence-informed decision-making, it's really the data use that is the finished product of a data value chain. And so how is it that we get there, that we have high quality information and data that are being used to make decisions? Well, we need to go across this value chain and understand how each element and link along this chain requires intentional investment if we want to have the data we need to make the high quality decisions we want to make. So it begins with prioritization, which is saying, what is the information? What are the data that we want to collect? And I think Joanne just pointed out the importance of not just thinking about what is the information we need today, but what is the information we need and the data we need to understand what are the problems of tomorrow? What are the emerging issues? And I think we've done a really good job of that in certain parts of the multi-sector system. The health system often has very clearly defined priorities for information, but there's been a real struggle as we look to some of the other sectors to say, what are those priorities and how do we measure them in a consistent way? So how do we define those indicators? As we move along the value chain, we talk about collection of data. So we need to invest in the actual acquisition of data through doing things like household surveys, through building administrative information systems, and through finding innovation methods to actually collect data at national and subnational levels at high quality. Curation is about bringing those data together so that people can use them. We have that, for example, in the DHIS2 is a way of curating the data and bringing it together so that people at different levels of the health sector can use it. We've seen some examples of using dashboards and other mechanisms of trying to make data more available and brought together. But it also is things like doing regular review meetings and making sure that people are getting data in front of them and using them. We move on to analysis, and this is about finding insights. So we can have our data, but how do we really take it and derive insights through analysis, through modeling, that helps us come to conclusions? And I think this is a place where we often see researchers and others getting involved in helping us use that data to derive insights. And then finally, in order for a leader or a decision maker to have the data, there often needs to be a step of translation. There needs to be someone who is creating a policy brief, who is putting together a scorecard, who is really a bridge between the outputs and the person who's actually going to make that decision. And so each step of this value chain is really important and requires intentional investment. But we also need to think about the foundation, because investments don't just happen and data chains don't just function, but we need strategic leadership. So we need to have strategies around how are we going to strengthen nutrition information systems in country. We need to make sure that the resources are there, that there's financing, and also that there is the human capacity to support strong information systems. And so we see those as places that we can invest to ensure a strong foundation. So you're going to hear some examples, I think, of commitments that are made to investing in maybe specific elements of this value chain, and then others that are made to kind of strengthening this more broadly. But I really hope that this explanation kind of gives you the foundation to move forward with this webinar. Thank you.
All right, thank you. Thank you, Rebecca and Joanne, for those insights. I think a few take-home messages: future-proofing. We need data for the future. The data needs to be well collected. There needs to be investment in data collection. So our next question, or another section rather, is going to be on moving from Tokyo to Paris, N4G. And we are looking at the progress and priority commitments for nutrition data. Now let's look at the progress we have made since Tokyo 2021 and the N4G summit, and discuss priority areas of investment ahead of the N4G in Paris. So unfortunately, we will not be joined by some of our invited guests. However, for this session, we have Sonia, the head of Country Action, Sun Movement, who will outline key takeaways from Tokyo and how they inform future commitments. And then she'll be followed by Nancy Abuto, who is the Deputy Director, Food and Nutrition Division of FAO, and the co-chair of the N4G Paris Working Group #4, who will also discuss the priority areas for policy and financial commitments for Paris. So Sonia, over to you. We'll start with you.
Thank you so much, Zipporah. So yes, we will start this presentation with some figures from the Tokyo summit. And I don't want to throw a lot of figures at you, but I think it's important to just start, and we'll go to the next slide, with just looking at some raw data from the compact annex. Let's go to the next slide, please. So yeah, overall, in the compact annex, you might have seen already that 396 new nutrition commitments were made by a total of 181 stakeholders across 78 countries. So that's a lot of momentum for nutrition gained by the Tokyo summit. And you can see the breakdown of stakeholders making those commitments. The bulk of them being made by government, 80 of them, international organizations, donor organizations, private sector, but also civil society organizations, many of them, and 7 academic research institutions. But then how to keep this momentum going and how to materialize and implement on those commitments being made at the Tokyo summit. So what we have seen, and of course the GNR, the Global Nutrition Report, has been extremely instrumental in this, is that the reporting around those commitments is not yet standardized or institutionalized. Of course, it's been highly encouraged by Sun for the Sun countries, but still from the GNR early on data, because they are still to release the taking stock report from the Tokyo and for the summit. But we can say already that half of the goals were reported against by half of the stakeholders. So that says a lot about also already what needs to happen next ahead of the N4G Paris summit. Because the commitments are as important as their if they are implemented against. And of course, the thing is we have seen is that the reporting has endured many challenges, limitations. Of course, progress overall was impacted by polycrisis, the turnover also by the structures and people making those commitments, accountability issues, but also limited progress has been seen on impact commitments, and the need for sure to further unpack those impact commitments and the pathways leading to impact change for nutrition. Also, there were limitations in terms of accountability issues being raised by commitments makers that were grouped together. That doesn't mean that coordination of multi-sectoral and multi-stakeholders collaboration for nutrition is not encouraged. That's really not the case. but it's just sometimes those commitments were made by different stakeholders that were not institutionalized, and then it was difficult to report against them. We can go to the next slide. Thanks. So also based on the Sun experience, I would like to now share with you some reflections around progress of those Tokyo commitments. So for the first time, and really thanks to the European Commission support, we've been able to prepare the countries moving towards the Paris Summit with a clear methodology around reviewing progresses for the past commitments and namely the Tokyo commitments. So the preparation for countries to go to the next summit was really based on what was committed before, what was achieved, so some self-assessment, and also taking stock of the challenges, the bottlenecks, and also opportunities to revise those commitments, to make new commitments, and to really analyze and then being able in another step then to make informed kind of commitments for the Paris summit. So it's really a two-step approach with starting with reviewing the past commitments. And doing that, I mean, if I take the example of the first 7 countries in Francophone Africa that used this methodology of reviewing their Tokyo commitments, one of the key elements was clear in terms of the lessons being that monitoring should be improved. I can take the example, for instance, of some goals, objectives that were really made in terms of increasing investment for nutrition, but then the realization that there was a limited ability to track progress towards reaching those goals because the financial information systems were not in place. For instance, like the budget analysis was not done regularly to keep track of progress. We can go to the next slide, please. So that being said very, very quickly, then I think there was a realization for the N4G Paris Summit that data needs to be quite front and center. To do better this time around, yes, the momentum to make those commitments, but also what is being done ahead to have plans beforehand to develop, I mean, to implement around those commitments. And we can see that data clearly is one of the 6 priority areas of the summit with a dedicated thematic commitment guide available as it was shared before. And already there are some quite interesting recommendations in the umbrella commitment guide in terms of stakeholders should submit commitments that are proportionate to their role and responsibilities, and also this encouragement, yet again, to earmark sufficient funds for monitoring results and reporting on progress in the NAF as really a good practice to be adopted systematically. And then, yeah, really the importance, again, in terms of generic encouragement on the making commitments that those commitments should be monitored, including through the annual reporting going to the NAF, thanks to the work of the DINA, the Global Nutrition Report, as part of the NAF tracking mechanism publicly available. That they should be accompanied also by a dedicated section for funding the accountability around the materialization of the commitment. So we can go to the next one. Thanks. So it's been what we have done for countries, the Sun support this time around, like I was saying, of course, the taking stock of the N4G commitments, Tokyo with the European Commission support and different TA providers, EU4Sun, C4N. But it's also not only reviewing those commitments from Tokyo, but it's also, again, developing roadmaps, leading the countries to the N4G summits, and really having those action plans to implement ahead of time on the different commitments that are being made. Also, there was an encouragement and an effort in the different workshops organized to promote peer-to-peer exchanges in order for countries to understand how they unlocked different bottlenecks to move forward with their commitments to materialize them. Also, of course, a lot of socializing the different guides. The NIPN partnership has been extremely valuable for us and for our son countries. And of course, we have been encouraging inclusiveness in the MSP to formulate and review the new commitments. I can say that there is quite a clear appetite from some countries to enhance their data systems. As Joan was mentioning, this is quite key for early action where it's needed in a timely manner. But of course, also the countries also need the support from the different partners to actually improve their data systems in a meaningful manner and in a multisectoral way. Thanks. We can go to the next one. Yeah, also very important to say that when we look at the different thematic commitment guides, a lot of references are actually about data and improving the data. So I am not going to go through the whole thematic commitment guides, but just to say that if you look at resilience to crisis, of course, one of the recommendations and call to action is actually to invest in the data and in early warning components of a national information system for nutrition. And similarly, in the financial one also, there's a clear encouragement to allocate 50% of new investment in nutrition for data and information systems strengthening. So that tells a lot about the importance that this summit is putting on the data. And also, if we want to build bridges between the different summits and make sure that those commitments are being delivered against, it's really through data and enhancing the different systems of data and monitoring of those commitments. Thank you.
Very much, Sonia, for that insightful reminder of commitments and how we look forward to N4G Paris. I'm going to shift our discussion. And so following the intro that we have had about the commitments, I think we have an incredible panel of experts who will speak about what country changes have taken place with regards to commitments in some of the countries that will be presented. So I want to start off with introducing Dr. Ella Compare, Technical Secretary for Mother and Child Food, Ministry of Health and Public Hygiene in Burkina Faso. Oh, sorry, I missed Nancy, right? Nancy, my apologies.
Yes, Sephora, it's okay. I'm still here.
I'm sorry about that. So sorry about that. Within the commitments of Tokyo to Paris, in discussion on progress and priority, Nancy should also give us some insights based on the experiences they've had as a FAO. Thank you. And sorry about that, Nancy.
It's okay. Thanks, Sephora. Good afternoon, everyone. Good morning, good evening to those of you around the world. I want to first start by congratulating the organizers today. What an excellent turnout, and not only high numbers, but I noticed in the chat people from everywhere. So I'm really honored to have the chance to speak with you today. I want to start by backing up just a little bit to give us a bit more of a big picture of what kind of data we're talking about when we're talking about data in the context of the Nutrition for Growth commitment. So if we could move to the next slide. it's good to remind ourselves, and I know most people here are so aware of this, but it's good to remind ourselves that good nutrition is actually an outcome indicator that recognizes that a myriad of systems are working efficiently, that they're working properly. And these are systems that allow us to have healthy diets, to have clean, hygienic environments, to have adequate sanitation, strong education, preventative and curative health systems, et cetera, et cetera. And so in order for us to understand what's driving malnutrition and how we can achieve good nutrition, we really need data and evidence across all of these systems. And these are multi-sectorial and multi-stakeholder systems. And that's where the complexity of what we're talking about with data and evidence really comes in. But as we just heard at Tokyo Nutrition for Growth, there was a discussion around data. It actually came out of the Financing for Nutrition Thematic Working Group, and it advised the Nutrition for Growth stakeholders around some potential commitments for strengthening nutrition data and information systems. Next slide, please. Therefore, within that Tokyo context, there was the development of this subcategory for the nutrition action classification system. And it was referred to as research monitoring and data. But this was a subcategory inside of another category called enabling action that was embedded in all the Nutrition for Growth pledges. Now, Sonia alluded to this, and she mentioned, I jotted it down, 396 commitments. We looked at the NAF and looked at pledges as opposed to commitments, so the numbers are slightly different. Just to say, for example, at FAO, we had 1 commitment but 4 pledges. So it's a slightly different way of looking at the data, but the point is that of the almost 900 pledges, there only 78 of those belong to this subcategory of research monitoring and data. And you might say only, oh, that doesn't seem like very much, but it was almost 9% of all commitments. And considering it was a commitment category within the bigger pledges, I think it got us going in the right direction in terms of thinking seriously about commitments for data. Next slide, please. So building on that recognition of the need to invest in data, in research, and in evidence, Team France, leading our planning for the Paris Nutrition for Growth, chose to elevate the visibility of this topic. And I really appreciate that leadership from France in this regard. And that is why we have this dedicated working group that we've already heard reference to, the Working Group on Data Research, Innovation, and AI. So it brought together a few different topics in a slightly different way than we had thought about them in in Tokyo. But the aim of this group was to facilitate commitments that can improve data. And this is data for better decision making. So not just data for data's sake, but data for decision making and improved accountability to maximize the impact of all of our commitments at all levels. That's global, that's regional, that's national, and even subnational. And this really came with a recognition of the immense challenges due not only to a lack of data, but also limited capacities, especially at national and subnational level. And but despite the fact that we've made improvements in this area, obviously in recent years, there's still fragmentation, and that fragmentation challenges nutrition because of what I referred to earlier, that multi-systems needing to be working well to ensure good nutrition. So if we move to the next slide, let me just take a minute to talk a bit about the process. We set up a group, and I was privileged to be representing FAO in chairing this working group along with my colleagues at WFP, and really want to commend the multi-stakeholder and multi-sectorial group that was set up to help think through this topic. We've been working for about 5 months now to do a systematic a conversation and stepwise process to try to help support you, to help support other stakeholders in making those most meaningful commitments in this space. So we started with identifying gaps, and we've already talked a little bit about these gaps, and I appreciate the previous speakers recognizing where we are in terms of data gaps. And the way that we described it in terms of what ultimately is the commitment guide for this working group is we saw one gap around a dearth of data, so some lacking in understanding of what is limiting our progress towards achieving SDG 2. But then also why malnutrition persists is another question mark for us in certain contexts, in certain populations. Why are we having challenges, for example, in reducing anemia, which is actually at the global level, the prevalence moving the wrong direction? And then finally, how to address all forms of malnutrition and how to do it in a cost-effective way. So that's one gap, is that actual data missing. The second was more about efficiency and effectiveness in terms of our tools and systems being in place to utilize this data. Also, when we're talking about innovation and artificial intelligence, challenges around the quality, the safety, and the security, as well as the inclusiveness of data that are driving these new tools when it comes to advanced technologies. And then the third gap that we saw is in the ecosystem of support, is the way we refer to it. And this is things like guidance and guidelines, capacity strengthening infrastructure and computing power, as well as challenges around human resources and capacities, especially in the context of this rapid pace of technology advances. Next slide, please. But it's not all doom and gloom, focusing on those challenges and those gaps, because once those were identified, it really helped us as a working group to identify opportunities for investment. And I think, Zephora, you said it right when you said these are 3 investment areas. Here I refer to them as opportunities, but I like the way that you said it. And those 3 investment areas, in general terms, are described as generating new evidence and innovation, having better data and knowledge management systems so that we can more efficiently and effectively use the data we have. And then finally, stronger systems and platforms and communities of practice so that we can learn from one another and be more effective and efficient collectively. And to realize these opportunities, we as a working group called on stakeholders to invest at least 15% of total funding for nutrition towards pledges across these 3 investment areas. So that key amount of 15% we came to as really an aspirational goal, a target for us to think about in terms of our financial investment in this space. Next slide, please. So the commitment guide from the working group also shares with us some examples of what commitments might look like. And I want to highlight my Venn diagram here. You saw it on the previous slide and you see it here. I used a Venn diagram on purpose because clearly these 3 gaps, these 3 opportunities, and these 3 investment areas are not mutually exclusive. And indeed, there are lots of commitments that can fall in a space that can respond to more than one gap and even all 3 gaps together. So I think that's important to recognize. Here I've shown 3 examples of types of commitments, and these aren't the SMART pledges. These are just commitments that different actors may want to commit to in the space of data research, innovation, and AI. And it's things like collecting data on MDDW, for example, and that might be something a government commits to. Another one might be develop and support the use of open source codes, and that could be a government, that could be private sector development partners. So we try to identify what stakeholders might make what types of investments. And my 3rd example here, and these are just examples, of course, is invest in continued strengthening of successful data, knowledge, and exchange platforms like those that came together for today's event. And moving on to the last slide. So in conclusion, I just want to say that this data research, innovation, and AI for Nutrition Working Group went through a systematic process of identifying gaps, outlining priorities, and providing guidance for commitment, guidance for you. And colleagues, we hope that this guidance, along with the vision from France and the moment we are in the digital revolution, really provides us with an opportunity to make not only serious advances in committing to nutrition data, but serious advances in acting against those commitments so that we can make a difference in terms of reducing hunger and malnutrition. And I think we are on the precipice of a real change here. And I hope that what we've been able to generate from the Data Research, Innovation, and AI for Nutrition Working Group can help us get there. So let me just quickly move to the final slide to acknowledge all of the partners at World Food Program and at FAO that helped host this working group, and really once again thank the entirety of the working group that got us to where we are today. Looking forward to your thoughts. Thank you.
Thank you. Thank you very much, Nancy, and really very good insights with regards to data and investment to make sure we have good information on platforms to share our findings. I will now shift to another section, looking at lessons on data commitments, looking at what countries have actually learned from the commitments that they made. So I will introduce one speaker at a time. I think that will be easier to track on the discussions that they put forth. But just before I introduce the next speaker, I would like to request that those of us who have just joined who might not be aware, please register yourselves on the chats. And those who have any questions, please use the Q&A section, which we shall handle at the end of all the presentations. So my next speaker is Ella Compare. And Ella is a technical secretary for Mother and Child Food, Ministry of Health. I don't know that that's right, Ella, you'll correct me if it's wrong. Ministry of Health and Public Hygiene, Burkina Faso. And she's also the nutritional focal person for Burkina Faso Sun Movement. So immediately after Ella speaks, I'll introduce the next speakers in line. So bear with me with that. With that, Ella, it's your time.
Merci beaucoup. I can use my camera because I want to improve the hearing, so I've decided to stop it. Does it okay?
Yeah, that is okay, Ella. Would you like, are you speaking French or English?
No, French. I will present in French because there are many French speakers who are here. So I prefer to speak in French. Merci beaucoup pour la présentation. Suivant, s'il vous plaît. The next, please.
Ella, before you start, maybe I can just guide the participants that they can actually join Wordly translation. You can see a chat on your screen. It's been displayed there. Okay. Please open and choose the language that you can listen to. So go ahead, Ella.
Merci beaucoup. Suivant, s'il vous plaît. La diapositive suivante. Donc, merci de nous avoir associés à cette réunion importante sur la gestion des données où nous voulons partager notre expérience. Would you move please to the next, please? Next again. Alors, merci beaucoup. Alors, quelle est l'importance des données au regard de notre expérience que nous avons au Burkina Faso? Il faut savoir que les données, c'est quelque chose de très important et au regard de notre grande expérience sur la gestion des données, il faut dire que utiliser des données, ça permet d'orienter, c'est-à-dire la rédaction des politiques, des stratégies, ça permet de mieux planifier sur le terrain la mise en œuvre des interventions et ça va de soi que si on arrive à mieux mobiliser tous les partenaires autour de la mise en œuvre des interventions, ça permet en fait d'avoir un bon suivi des indicateurs et d'avoir un bon financement. Et si on regarde le contexte de nos jours, on a en réalité un grand intérêt des différents décideurs sur les questions de nutrition et de ce fait, en utilisant des données pour avoir des décisions qui sont plus provantes, en ayant des évidences qui sont plus solides, on arrive à mieux engager ceux qui sont en tête des décisions et ça permet en réalité d'avoir un bon leadership, d'avoir une bonne redevabilité au niveau des différents acteurs parce que chacun se sent plus responsable quand on travaille. Suivant, s'il vous plaît. Et si on va directement aux différentes expériences que nous avons eues en fait au Burkina Faso, vous allez voir que la première initiative que nous voulons partager, possible to move to the next, please. Si nous regardons un peu les grandes disons les initiatives que nous avons mises, la première présentatrice a parlé un peu de ça, de l'expérience du Burkina qui est la plateforme nationale d'information en nutrition. Et quel est en fait son objectif? C'est pouvoir renforcer le système d'information, c'est-à-dire améliorer la surveillance nutritionnelle et en quoi faisant? En utilisant en réalité des données existantes pour pouvoir tirer le meilleur parti donc de l'information qui est contenue dans ces données et puis pouvoir appuyer plus efficacement la prise de décision. Ça veut dire qu'avec l'initiative PENIM, qui est une initiative qui existe dans 9 pays et soutenue par plusieurs partenaires techniques et financiers, on arrive en réalité à avoir une meilleure décision sur la base de l'existant. Ça veut dire qu'il y a beaucoup d'informations qui existent et donc c'est comme une valorisation secondaire des données, mais en tenant compte de ce qui est actuel. Et avec la PENIM, la première sous-initiative qui a été mise sous SAT comme étant un résultat majeur, c'est la mise en place d'une plateforme de diffusion des indicateurs de nutrition. Et pourquoi en fait mettre en place une plateforme de ce type-là? C'est pour pouvoir permettre d'utiliser les indicateurs, c'est-à-dire pour permettre à quelqu'un de pouvoir donc les diffuser. Ça veut dire que c'est une plateforme qui diffuse les données et tout le monde a accès à cela. Et c'est cela donc téléchargeable sous des formats tels que Excel ou bien PowerPoint. C'est ça l'importance en fait de mettre en fait cette plateforme qui s'appelle Open Data, dont vous voyez le lien ici à l'écran. Alors, la suivante, s'il vous plaît. Et avec toujours la plateforme nationale d'information en nutrition, ce qu'on a mis en œuvre, c'est une plateforme web qui existe. Suivant, s'il vous plaît. Et c'est une plateforme web qui est accessible, quel que soit l'endroit du monde où vous êtes, où vous allez avoir les documents stratégiques, vous allez avoir les différents résultats d'analyse qui existent, vous allez avoir la contribution des différents secteurs qui va se trouver donc au niveau de cette plateforme web-là. Donc, ça va assurer une meilleure visibilité, ça permet aussi une plus grande accessibilité de l'information. C'est ce que ça permet d'avoir en réalité. Donc, c'est une plateforme qui est extrêmement dynamique et qui nous permet en tout cas d'être en temps réel, en fait, et en train de diffuser l'information, quel que soit l'endroit du monde où on est. Alors, si on passe à la suivante, next please. La suivante, en fait, ça va être on a mis en place, en fait, un entrepôt de données sur la nutrition. Et pourquoi, en fait, un entrepôt de données dans le cadre de la valorisation des données à travers la PENIM? C'est que c'est un entrepôt, en fait, c'est comme, disons, comme je dis, un entrepôt où on va avoir la plupart des données primaires qui sont disponibles. Les données-là sont, en fait, issues des différentes enquêtes, surtout les enquêtes à envergure nationale, qui sont alimentées depuis 2020. Et avec cet entrepôt, tout le monde peut pouvoir demander les données primaires, mais il y a des conditions d'utilisation. Ça veut dire que ce n'est pas quelque chose qui est accessible en ligne. L'entrepôt existe et on arrive à demander et on peut autoriser spécialement pour qu'on puisse accéder à cela parce qu'il y a des moments où les gens ont besoin des données primaires pour pouvoir avancer. Et vous avez en fait le lien ici pour pouvoir demander et on va statuer et puis voir quelle est la possibilité de donner donc ces données. Parce que nous savons qu'en matière de données, il y a un certain nombre de confidentialités qui existent et c'est selon la pertinence du travail que l'on veut faire qui va rendre cela accessible. Mais avec la plateforme nationale d'information nutrition, on est arrivé à faire cette troisième sous-initiative. La suivante, s'il vous plaît. Alors, la quatrième sous-initiative qui a existé dans le cadre donc, de la PENIM est le développement d'une application mobile. Please, could you move to the next, please? C'est le développement d'une application mobile. Pourquoi une application mobile? Nous savons que si on considère un peu les différents enjeux sécuritaires qui existent et aussi avec l'innovation qui est présente actuellement quand on parle de gestion de données, on utilise beaucoup plus le téléphone. Et donc, on a développé cette application mobile pour qu'on ait une accessibilité et pour qu'on puisse avoir un suivi de différents indicateurs que l'on peut télécharger en temps réel sur le téléphone. On peut, c'est accessible, c'est très responsif et on peut suivre un peu comment évoluent ces différents indicateurs. Et les indicateurs dont il est question ici, c'est ce qui est issu de la politique de nutrition à travers le plan stratégique multisectoriel. Et en parlant de plan stratégique multisectoriel, c'est des indicateurs qui ont été définis avec tous les secteurs de façon consensuelle et la responsabilité donc incombe à tout le monde et chaque secteur est responsable de ces indicateurs. Mais quand on se retrouve un peu dans le cadre du suivi des indicateurs globaux, donc tout le monde en fait se sent redevable de cela. Si vous passez à la suivante, vous allez voir qu'en réalité, c'est une autre initiative qu'on a développée aussi dans le cadre de la gestion des données et qui est en fait, please, may I ask you to move to the next again? Alors, dans le cas toujours de la plateforme nationale d'information en nutrition, il y a eu en fait de la recherche qui a été opérée dedans. Rappelez-vous que je disais que l'une des initiatives, pour ne pas dire l'initiative phare, était en réalité d'utiliser les données existantes pour tirer la meilleure partie, la plus-value de l'information afin de contribuer en fait à répondre à certaines questions. Et pour cela, il y a des questions de recherche qui ont été développées dedans et vous allez avoir une capture ici des différents rapports d'analyse qui existent. Vous allez avoir par exemple des questions qui se sont intéressées à la contribution de la sécurité alimentaire pour améliorer les questions de nutrition, les questions de WASH pour pouvoir améliorer la nutrition. Vous allez avoir un peu les questions qui sont liées à la carence aux micronutriments, surtout l'anémie, des questions qui se sont intéressées par exemple au financement de la nutrition, à savoir qu'est-ce que l'on doit faire concrètement si on veut infléchir les courbes de la malnutrition, vu que les prévalences sont assez élevées. Il y a aussi des études qui ont été, une étude qualitative qui a été faite pour comprendre les déterminants de la malnutrition. Donc, il y a 14 questions qui ont été développées et vous allez avoir 14 documents qui existent, donc qui ont répondu à des questions de façon notable. Et parmi les résultats phares que ces analyses ont trouvés, on a vu que il faut qu'on améliore le financement de la nutrition, ça veut dire qu'on doit mettre plus d'argent dans la nutrition, on doit faire des interventions qui sont beaucoup plus à haut impact, telles que décrites dans le plan stratégique de nutrition. Il faut qu'on puisse mettre en œuvre la multisectorialité, où on travaille conjointement ensemble, et on a vu qu'en réalité, il faut beaucoup plus travailler sur des questions et qui sont liées à une meilleure consommation des aliments, diversité alimentaire. Donc, c'est ce que essentiellement ça a donné comme résultat phare. Mais tout cela est accessible sur la plateforme web que j'ai présentée tout à l'heure. Si vous passez à la suivante, s'il vous plaît. Si vous passez à la suivante, ça, c'est une autre initiative qu'on a mis dans le cadre, en fait, de la gestion des données. Et ça, c'est le développement des cartes de score. Tout à l'heure, quelqu'un parlait des cartes de score. Pourquoi? Parce qu'en réalité, c'est une initiative ici qui va permettre de suivre la performance des différents indicateurs. Avec la PNIN, on utilise les données existantes et on doit prendre les meilleures décisions et on sait en fait sur quelle voie, là où il faut actionner. Avec les cartes de score, on va prendre les différents indicateurs qui sont définis, peut-être la malnutrition aiguë, la malnutrition chronique, on prend tout ce qui est en lien avec la diversité alimentaire et on va peut-être essayer de suivre la performance de ces indicateurs par région. Donc, c'est sur l'ensemble du territoire. Vous allez avoir l'indicateur au niveau national, mais vous allez avoir aussi les indicateurs que l'on suit par région. Et ce que ça montre ici, c'est que c'est essentiellement un suivi à partir d'un code couleur. Suivant, s'il vous plaît. Suivant, the next, please. Donc, c'est à partir d'un code couleur. Et si c'est un code couleur, qu'est-ce que ça veut dire? Ça veut dire que c'est un système de gestion des données en ligne avec des codes couleurs. Et quand vous voyez que c'est rouge, ça veut dire que l'indicateur dont il est question n'est pas en bonne voie. Si c'est en jaune, ça veut dire qu'il y a des progrès qui existent, mais il faut encore faire des efforts supplémentaires. Si vous voyez qu'il est en vert, ça veut dire que la cible est atteinte ou bien c'est en bonne voie. Donc, on a utilisé un peu cette stratégie aussi pour suivre tous les engagements que l'on a pris dans le cas de de nutrition pour la croissance de 2021 de Tokyo. Ça veut dire que nous avons pris au moins 12 engagements et pour chacun, nous avons essayé de les retracer comme ça et on arrivait donc à pouvoir faire le reporting sur le NAF. Et on arrivait en fait ici à définir des actions. Parce que quand vous voyez l'indicateur qui est au rouge, on va définir un certain nombre d'actions. Allez-y au suivant, s'il vous plaît. On va définir un certain nombre d'actions pour dire qu'est-ce qu'on doit faire concrètement pour pouvoir améliorer la situation. Et sur cette base, est-ce qu'on peut aller au suivant, s'il vous plaît? Voilà, merci. Donc, vous allez voir qu'on va définir un certain nombre d'actions et de mesures pour pouvoir en fait dire qu'il faut mettre ça en œuvre. Non. Get back, please. Come to the previous one. Get back, please. Merci. Donc, avec les cartes de score, je résume ici, ça veut dire que ça va permettre... Non.
Next.
Please move to the next. Not the next, but the next. Yes, it's fine here. Could you stay here? Merci. Donc, si on utilise les cartes de score, ça permet donc de prioriser. Ça veut dire qu'on donne beaucoup plus d'attention à un indicateur. Ça permet d'analyser les causes profondes du problème et ça nous permet en réalité de trouver des solutions. Et j'étais là-bas. J'étais à la partie comment on fait pour pouvoir trouver des solutions. Ça veut dire que si en fait on voit que la couleur en termes de performance de l'indicateur est au rouge ou au jaune, ça veut dire qu'il faut développer des actions concrètes, des mesures nécessaires et en définissant ça à partir en fait de certaines actions à mettre en œuvre sur le terrain. Et ça, ce sont des actions en général qui sont multisectorielles. C'est pourquoi j'ai dit que tous les acteurs se sentent redevables de cela. Voilà. Donc, ça permet donc de prioriser, d'analyser et de résoudre. Si vous partez maintenant au suivant, move to the next now. Merci. Donc, la troisième sous-unité maintenant, ça va être l'utilisation d'un dashboard. Alors, si vous regardez bien ce qui est à l'écran, vous voyez qu'il y a des chiffres en réalité. Ça veut dire que c'est un certain nombre d'indicateurs qui sont là. Et avec le dashboard multisectoriel, qui est une autre sous-initiative que nous avons développée pour pouvoir bien suivre les indicateurs, vous allez voir que pendant plusieurs années, vous avez le suivi des indicateurs et maintenant, on va peut-être à partir d'une courbe ou bien d'un histogramme ou bien de tout ce que vous voulez pouvoir suivre son évolution. Là, on pourra savoir est-ce qu'il chute vraiment, est-ce qu'il augmente comme il se doit, peut-être comme l'allaitement exclusif, est-ce qu'en réalité, il évolue en dents de scie. Donc, ça permet de suivre de façon pertinente l'indicateur. Donc, ça, c'est essentiellement l'évolution que l'on peut montrer. En fait, c'est une visualisation de l'indicateur que l'on va faire ici. Et si vous partez au suivant, s'il vous plaît, allez-y à celui qui suit, s'il vous plaît. Voilà. Pourquoi donc créer un dashboard? Ça permet de visualiser facilement les différents graphiques, les tableaux et puis les figures. Et ça permet en fait de faire un suivi régulier en fait de la tendance de l'indicateur, c'est-à-dire son évolution. Je vous montrais tout à l'heure, si on considère depuis 2018, 2020, il y a des chiffres. Donc, ça permet de suivre pour pouvoir faire un tracé pour que l'on puisse savoir cet indicateur-là, est-ce qu'il zigzague, est-ce qu'il évolue normalement ou bien il faut faire plus d'efforts. Et avec le dashboard aussi, on peut suivre la qualité des données parce que ça permet vraiment, s'il y a une chute brutale, on essaie de comprendre pourquoi c'est comme cela. Et surtout, ça permet de partager l'information assez facilement sans aucun effort. Et tout ce que nous avons présenté, allez-y au suivant s'il vous plaît, tout ce que nous avons présenté paraît vraiment bien, tout ça, mais il faut savoir qu'il y a un certain nombre de difficultés quand on parle de la gestion des données. On peut aller au suivant s'il vous plaît? Il y a un certain nombre de difficultés quand on parle en fait de la gestion des données. Parce que en fait, l'un des grands problèmes dont quelqu'un avait déjà parlé tout à l'heure, c'est l'indisponibilité des données. Tout le monde est d'accord que c'est bon d'utiliser les données, qu'il faut travailler pour avoir une meilleure prise de décision, pour pouvoir améliorer les indicateurs, pour pouvoir améliorer en fait l'alignement des acteurs. Mais quand on collecte des données qui coûtent relativement cher, on se rend compte que certains secteurs ne veulent pas les partager. Les gens veulent les garder comme des biens personnels. Ça, c'est un grand goulot d'étranglement. Hein? La collecte coûte très, très cher, mais plus tard, on se rend compte que les gens ne veulent pas les utiliser. Et donc, c'est pour en même temps dire que si un secteur pour le prochain, en fait, Nutrition pour la croissance qui est le mois prochain. Si on décide de prendre des engagements, et moi j'encourage tout le monde à prendre des engagements dans le sens de la gestion des données, il faut que l'on soit sûr qu'on améliore non seulement le financement, mais aussi que les secteurs se sentent redevables en rendant disponibles les données pour qu'on puisse en fait les utiliser pour pouvoir améliorer la prise de décision. On peut faire des analyses, des collectes de données pour un problème précis, mais il faut le rendre disponible pour que d'autres personnes puissent les utiliser pour travailler. Alors, l'autre problème aussi, c'est l'illégalité des données, mais ça, c'est essentiellement dû au manque de financement, parce que souvent, on est accompagné par des partenaires techniques et financiers, mais avec les différents enjeux qu'on a un peu partout, il peut y avoir en fait un certain nombre de programmes qui s'arrêtent ou bien un certain nombre de réductions de budget. Le contexte social aussi souvent ne permet pas avec l'insécurité d'avoir une bonne couverture des données ou en termes d'accessibilité en fait pour la collecte des données. Et aussi, on en reparlait, il y a un certain nombre d'indicateurs qui a été appelé à changer si on prend le contexte du Burkina, surtout ceux qui concernent la protection sociale. Hein. Et il faut encore rappeler qu'on ne collecte pas des données pour ne pas les utiliser. Il faut toujours les utiliser. Et donc, c'est un appel à dire qu'il faut véritablement utiliser les données comme il se doit, mais des données de qualité. Une chose est de collecter les données, mais il faut qu'elles soient de très bonne qualité pour qu'elles puissent effectivement faire sens lorsque l'on prend en fait les décisions. Et si vous partez à la dernière diapositive, allez-y, de last one, allez-y à la dernière s'il vous plaît. Si vous prenez la dernière diapositive, vous verrez que nous, on dira que sur la base de tout ce qu'on a présenté, c'est un travail qu'on a fait depuis longtemps, soutenu par plusieurs acteurs, on dira qu'il est vraiment fondamental et urgent que lors du prochain Nutrition pour la croissance, tout le monde puisse prendre des engagements en faveur de la gestion des données. Parce que c'est indispensable que tout ce que nous prenons maintenant comme action soit basé sur l'évidence avec des fondements qui soient très, très forts. Il faut qu'on puisse le faire. Et ça a montré que c'est vraiment efficace dans la lutte contre la malnutrition parce que quand on parle, on montre quelque chose. Peut-être quand on va à une réunion d'un certain niveau, on montre l'évolution des cadres de score et tout le monde voit comment évoluent les différents indicateurs. On peut, c'est selon la cible que l'on peut pouvoir le développer. Les cadres de score, on les a développés essentiellement pour les décideurs aussi directement. Ça, c'est un message qui parle. Donc, quel que soit ce que l'on va développer comme initiative, il faut vraiment que l'on s'y mette dedans. Parce qu'en tout cas, il y a une plus-value dedans. Et donc, je dis merci à tout le monde et on reste disponible pour pouvoir prendre les questions. Merci.
La question qui était déjà dans le chat box.
Thank you, Ella, for the insightful presentation. I hope participants, you are able to follow the translation on the screen, but nevertheless, this presentation will also be available later on the Micronutrient Forum website. So allow me to introduce the next speaker, Reid Atkin, who is a senior advisor at Micronutrient Forum. Reid, next to you, go ahead.
Thanks, Sephora. Thanks, Sephora. Assuming everyone can hear me, I want to echo much of what the others have shared, but do so through the context of large-scale food fortification. So during the run-up to the Tokyo N4G summit, there was a white paper that was issued calling for more money for nutrition and more nutrition for the money. And I thought that in the run-up to Paris, we could adjust that and say, we need more data for nutrition and more nutrition from the data. So if you can go to the next slide. I want to give you a little bit of context around what I'll be sharing. And that is from the Global Fortification Data Exchange, which is a collaboration between the Micronutrient Forum, the Iodine Global Network, the Global Alliance for Improved Nutrition, and the Food Fortification Initiative. We collect data on 5 food vehicles. We put that data into a website and package it in different ways and actively try to disseminate that data to national, regional, and global actors. So in that context, I want to share, if we can go to the next slide, the indicators that we focus on within the GFDX. We've organized our indicators into 3 categories: the opportunity, foundation, and performance. So opportunity is a question of the current status of a population, the amount of food and dietary habits, food consumption and dietary habits to identify where there's good opportunities for fortification. You can see we have 5 indicators on that listed below. We also do a lot of work on the foundation of fortification, largely mandated fortification, looking at what laws and regulations are, if they're being followed, if those requirements match global guidelines, and we will soon be implementing regional guidelines as well, as there's an increased move towards regionalism within fortification. Finally, we try to collect and disseminate performance indicators around food fortification, looking at how effective are these programs, what are their reach, and how are they impacting human nutrition. I share this with you because I think it's very interesting and very important to operationalize some of the context we've heard earlier. So if you think about the comments that Rebecca started the webinar with, talking about the data value chain, and then you look across any of these 18 indicators, I think it's quite possible to see how each of these indicators needs support throughout all the elements of the value chain. Not just in collecting data, but being able to warehouse that data, make it accessible, and turn it into insights, and then finally communicate those insights to decision makers or program implementers to improve nutrition. So if we go to the next slide, we've done some analysis on the data in GFDX, and we're calling this a baseline analysis of the current existing data. We collect our data through a variety of resources, through partnerships, through surveys with national stakeholders, through culling through published material. And we've done this exhaustively for years now and are very proud of the data set, but admit that there are still gaps. And this slide shows a lot of what we have and a lot of what we don't have. And I think some of it might be indicative of the efforts we've gone to at GFDX to collect the data, but I think a lot of it is indicative of that data not existing or not being unlocked, as has come up earlier in the webinar. So you can see we have an awful lot of information about the opportunity. If you want to get more nutrition from the data, I think looking at that opportunity area of GFDX, identifying what basket approach of fortification might be best for a population is a very good opportunity in most contexts. Then you start looking at the foundational documents and you see there's a lot more scarce data. Pulling foundational documents, legislation, regulation, making sure it's canonical and translated is very challenging. In the countries that do have mandatory fortification, we try very hard to pull and publish this data to make sure that we can do analysis and others can do analysis on if it's in line with global or regional standards. This is very important, particularly when you think about trade affecting fortification, but we need to get that data more published. So that's something that we're working on at GFDX, but I think an area of concern for the field. And then if you look at performance data, compliance, coverage, and the health impact, you'll see we have substantially less data within GFDX there. And again, I think that's a reflection on the field that has already been mentioned in this webinar, but is worth repeating, that we need to do a better job of collecting this data. And when we do collect the data, we need to do a better job of publishing it and socializing it so that everybody, both within a country and across countries, can use it to inform their programs. So I hope this serves as a call to action that we do need more data, particularly in performance, measuring the success of programs. I think it's critical that we're collecting, and when we do collect, publishing the data, but we also have opportunities to get more nutrition from the data we already have, and that lies largely in the opportunity area. The one last point I'll make before wrapping up is that, and this has come up in the webinar, and I believe was a question already submitted about making this data more broadly available. And at GFDX, we are very proud of the data we've collected, and it's taken an awful lot of work, but that data is only as useful as much as it's used. So we are in the process of building what's called an API that will be able to transmit that data to partners who want to download it and analyze it, or who want to publish it alongside other data in their databases. So we think it's critical that GFDX data be available not just on our website, but available anywhere others might want to use it. And we would encourage everybody else in the field to do the same. I think the more we can get the data into the places where people are using it, the better off the entire field will be. If you could please go to the next slide, I'll just add that GFDX, through our partner organizations, HKI, GAIN, and IGN, does provide technical support if there are questions about any of this fortification data. So I've included the email address of GFDX, info@fortificationdata.org, and those organizations and the Micronutrient Forum would be happy to support any national actors who are looking at building commitments around data, particularly fortification data, in the run-up to N4G this summer or spring. With that, back to you, Zipporah. Thanks.
Thank you. Thank you very much, Reid. And I mean, a very good platform that I want to urge all participants to find time and just interact with that website. Thank you. Next, I would want to introduce our next speaker on lessons on data commitment. And that will be Dr. Sise Sinamo, who is the Senior Program Manager at Segota Declaration, Ministry of Health, Ethiopia. And just to also note that we are running out of time, so I'll be happy, Sinamo, if you could just keep your presentation to about 5 minutes so that we have a few minutes for the Q&A session. Thank you. So over to you, Sinamo.
Thank you so much. So I'll be sharing the Ethiopia's experience and lessons on the data-informed decision-making based on the Segota Declaration experience. Next slide, please. So the Segota Declaration is the government of Ethiopia's commitment for ending stunting among children under 2 years by 2030. It was launched in 2015 and has 3 phases, which we call it innovation, expansion, and scale-up phases, each of which have 5 years. And currently we are at the expansion phase, and overall we aim to reach over 7.8 million children by 2030. In 2021, we made a commitment to accelerate the food and nutrition strategy implementation and also the Segota Declaration. So I'll be reflecting on how we have progressed using data. Next slide, please. So the Segota Declaration is implemented by 15 implementing sectors, and we have 10 innovation, one of which is what we call the data revolution, where we generate data using the Unified Nutrition Information System for Ethiopia. And we use that for performance scorecard, course correction, as well as also ensure accountability and also program geographic expansion decision-making. Next slide. So this data is being used at a very high level, at the leadership level, which is led by His Excellency, the Deputy Prime Minister, as well as also at 12 regions and 2 city administrative level to review the progress and make decisions, as well as also course corrective actions. Next. So just to give you some insight in terms of the phases decision-making, when we start the program, we started in 40 waradas, and after implementing between 2018 and 2020, we also did the impact evaluation with the help of John Hopkins EPHI to see how much we have attained in terms of stunting reduction. And as you can see slide, we have been able to reduce around 7% and 6 percentage points in terms of the 2 regions, and also have been able to avert stunting over around 110,000 children during this period. Next slide. So based on this, we have made a decision to expand the program from 40 waradas to 240 waradas in 2021. We're covering over 1 million pregnant lactating mothers and also over 2.2 children under 2 years. As you can see on the graph, these are the geographic spread of the districts across the country. Next. We also use the Unified Nutrition Information System for Ethiopia to assess the performance of the regions, the performance of the specific districts using a scorecard, as well as also to assess the performance of sectors and various indicators, and also the investment that has been made. Moreover, we have been reviewing in terms of the expansion phase in the past 2 years, and we have been able to avert nearly 60,000 children from stunting in 2020. and nearly 100,000 children in 2020 based on the impact assessment we have made. We also projected to reach over 5.7 million children in the coming years. So this data has really enabled us, next slide, to make the geographic expansion decision from 240 waradas to 700 waradas in the coming 3 years. And also, as you can see on the graph, the federal and the regional government investment also decision is also going high based on this evidence-informed decision of the geographic expansion. Next. So in conclusion, the data revolution, this is one of the 10 innovations of the Sakota Declaration. It has really helped us to make a strategic decision and also to improve the outcome in terms of the days and stunting aversion, as well as also critical decision making for geographic expansion, as well as also the course correction and also the Sakota Declaration investment. So based on this learning, the financial and program data generation to inform decision and enhance accountability is one of the Nutrition for Growth Paris 2025 commitment, which the Ethiopian government will unveil during the side event. I thank you. Over to you.
Thank you, Dr. Sinam, and really appreciate that you actually kept your presentation in 5 minutes. So as we wind up the webinar, I just want to express gratitude to all the speakers for the work they have been able to present to us. I think we've learned quite a number of things that we probably were not aware of. I want to hand over the next session of Q&A to Saskia. Saskia is the Executive Director of the Micronutrient Forum. But before she just takes on, I wanted to just do a quick run if Martha Eugenia is with us, if she managed to join. No? Okay. All right, over to you, Saskia, to take on the next session.
Yes, thank you, Sipora, and thank you very much to all the speakers and for all of those that listen in. And I do notice that we only have 9 minutes left till the end of the webinar. So I would like to keep it brief, but there have been some questions in the chat, and I think if I can group them, they have been around the need to allow access to data and databases, and I think that also was alluded in some of the presentations, and this particularly refers to the need to be able to get access to the DHIS two systems, as well as allow interoperability of these systems. Then there have been a number of questions, obviously, about the impact of the recent cuts in the budgets for these data systems because of the what happens to USAID. And I think I want to ensure you that data is going to be critical for us to be able to understand what the impacts are of budget cuts in development, to be able to understand where the biggest gaps are, and to be able to understand to fill the biggest gaps. So there are, as we speak, there are activities underway to try to get an insight into that. But obviously, it's still very early days to fully understand what the impacts are of these budget cuts on the different data systems. Needless to say, and that brings me to the third set of questions that I saw in the chat, it is important that countries include budget for data systems in their nutrition commitments that they make at N4G. And to that, in that regard, there was a question on, and I think that's a question particularly to Sun and to Ella, of, you know, what are the biggest challenges in order to convince countries to invest in data. So I would like to maybe first ask my question to Ella, and I'm not sure, Ella, if you can unmute yourself and go on screen again, but you have been, and maybe, Sonia can also assist there, because you have both been working with countries and you on their N4G commitments. I would like to know, what barriers do you encounter for countries to include funding in their commitments for data and data systems? Maybe Sonia, if you can unmute yourself.
Sure.
And yes, and maybe if you can address that question.
Yeah, so I think like what I saw, and this is also related to the Burkina experience, and you will remember, Saskia, we were talking about it in the data group leading us to the global gathering also. I think that it's like when countries are investing in data and that actually yields in understanding the impact on nutrition, the efficiency and the buy-in from the different stakeholders on a new approach, and that results to scaling up of a new approach like the use of the IMCI protocol in Burkina Faso, based on evidence from the London School of Hygiene and Tropical Medicine. This is quite clear in terms of, and the minister himself would tell you that from Burkina Faso that the decision to scale up this program was really based on information from the research. And if donors like the Bill and Melinda Gates Foundation didn't invest in having a substantial, significant research part component of the approach, then the scale up would have never happened. So I think this is those kind of examples that also we take forward to show how meaningfully we can change also the primary quality of the data, and then have approaches that have been proven effective and efficient being scaled up for a whole country. So, and maybe also what I should have mentioned is I think that there is I'm encouraged by the draft commitments that I'm seeing from many countries coming our way in terms of also investing for data. Some of them sometimes do not have targets as we could have wished for, in terms of respecting also the guidance from the N4G organizers and the thematic group around data. But still, this is really encouraging that if countries are submitting their commitment, 3-4 commitments, and one of them is really around making sure that those new approaches include a substantial component around research to know if it's useful or not to scale up, and so that the decisions are evidence-based. This is really reassuring. And also to manage and fill in the gaps in terms of knowledge that needs to come to the practitioners to make actions.
Thank you very much. And that is really indeed very encouraging to hear that already countries are including this in their commitments. Then to the issue of the need to make sure that DHIS are accessible and also are integrated into routine systems. Now, there has been a response in the chat, in the Q&A chat, by Noreen Mucha, and I'm not sure if she's online and if she can unmute herself, but she has been working on providing more technical support and also has been sharing some lessons learned. And I think that also speaks to the need of that third bucket of investments in data value chain that are really needed, which is to support communities of practice and to support technical, groups that can provide technical support. I would like to ask you, Noreen, if you could please unmute yourself and maybe give a few examples of the lessons that you learned. And if that's not possible, if you could please then share the report with the organizers of the webinar, so we can make sure that it is being placed on the web page that we will share with all of you, that will contain the recordings of this webinar, as well as the presentations and some additional information, such as the commitment guides for N4G from the working group. So I'm not sure if you are if you are able to unmute yourself, Noreen, but if not, then there you are. Yes, can you please unmute yourself and?
Sure. Yeah,
yes.
no, I was saying, happy to share what I learned. That unfortunately the report was funded by USAID, so I can't share it because it wasn't approved, and obviously. But yeah, happy to share what I learned. And so if someone wants to follow up with me, I can give some kind of like high bullet points, lesson learned. But I would say the main lessons learned are basically, that there are DHIS2 in, over 70 countries. And most countries just need technical assistance to really integrate nutrition into the existing system, whereas they are reporting on a lot of the nutrition indicators, but they need guidance on how to correctly report on those and see if there's any additions. And then a lot of countries are embarking as well on community health information systems. So it's just really a matter of also making sure that nutrition is integrated into that and, you know, pilot tested and scaled up. Over.
Yes, thank you very much, Noreen, and it's really appreciated if you could share that with the participants. I also do see a question in the chat from Carrie, who is with the Global Nutrition Report and Path, and is also hosting the database of all the N4G commitments, requesting you all, if you know about commitments that have been made in this space for N4G, to please make sure they registered through the link that is provided. So that is, I think, one last comment that I want to highlight. So with this, I would like to close the webinar. I would like to thank all the speakers for sharing these excellent experiences from Senegal, Burkina Faso, and from the GFDX, how data can really help to inform decision making and how access to data can really help us to make more progress in nutrition. And as I said in the beginning of my presentation, these are indeed challenging times, and we don't really know and fully understand the full impact of the changes that are happening out there. But if in any case, what we do know is that now more than ever, we really need to rely on data in order for us to be very, very efficient with the resources that we have, in order for us to reach the most vulnerable, the ones that are most in need, the ones that face the biggest gaps and challenges, and in order for us to make progress on nutrition. So I would like to end with asking you all to stay in touch and to visit the DINA website of the Micronutrient Forum, which will host the recordings of this webinar. The recordings will also be made available for those of you that are working with countries to make commitments, so that they can be informed, along with the commitment guides and other supporting materials that you could use in the discussions. And we look forward, of course, to see you all again and to hear from you all again in March N4G. Because if we learn one more thing in challenging times, that is that we should not give up and not prevail, and we should really focus on data and evidence and tell the world what is at stake at the moment, and tell our decision makers what they need to do and where they need to invest in order to make sure that we continue our impressive improvements in nutrition. With that, I would like to thank you all, and I wish you a very pleasant day, and see you again. Bye-bye.